London, Mathis Moore, and Dennis Moore. Go ahead and Billy.
Very good. Close to 1 billion people, 1/8 of the world's population, still live in hunger. Each year, 2 million children die through malnutrition. This is happening at a time when doctors in Britain are warning of the spread of obesity. We are eating too much while others starve. Jonathan Sachs. The sources I use today are www.newsmedia.net, www.articles.mercola, www.getamericafit.org, www.cdc.gov, www.fitness.gov, www.healthyamerica.org, www.vitals.com, www.movemequotes.com. Problem that we are currently having is an epidemic of obesity, and the solution to this is working out / getting physically active, and that will decrease or even eliminate obesity altogether. When most people think of obesity, they think of a person that's like 300 or 400 pounds. But obesity is actually your mass body fat. If you have a lot of body fat, then you are considered obese. You could be 120 pounds, but you have a large amount of like body fat around your abdominal area, or you have a large amount of fat around your thigh area. Even 120 pounds are considered obese. When people think of obesity, they think of people that are 300 or 400 pounds heavy, and that's called morbid obesity. And these are just some types of obesity. That's the one with the large amount around the abdominal area, and that's the man's abdominal area. And the morbid obesity is what most people think of as obesity. There's just all different types of obesity, and morbid obesity is what most people think of. But even at 120 to be obese. Obesity comes with many health problems. It comes with diabetes and high blood pressure, heart diseases. It can even lead to cancer, asthma. Obesity affects all different races. It doesn't just happen to one individual race. It happens to Hispanics and blacks and Caucasians. 49% of blacks are obese, 39% of Hispanics are obese, and 34% of Caucasians are obese. Obesity is the second cause of preventable death in the United States. 58 million is overweight, 40 million is obese, and 3 million is morbidly obese. Obesity also hurts the economy because obese people in medical costs cost $1,429 more than an average person would medically. And the massive number of medical costs for obese people is $147 billion, which of course we could always do somewhere else. We must not constantly talk about tackling obesity and warning people about the negative consequences of obesity. Instead, we must be positive about the fun and benefits of healthy living, trying to get rid of people's excuses for being obese by tackling the issues in a positive way. By Andrew Lewis. The solution to tackling obesity would be to become physically active. This is a good solution because it is easy to do. You start with small steps. You don't have to immediately jump into going to a gym and being a gym rat. You can do something simple like taking the stairs instead of an elevator, or parking in a bar parking lot and walking to the destination that you are trying to get to. And benefits of becoming active is you feel condition the heart and lungs, you build bones, you improve your health, you increase your chances of living longer, you reduce your fat, you pretty much change how you see yourself. And more importantly, you prevent chronic diseases. You eliminate your chances of cancer, you decrease your chances of stroke, and having high blood pressure, high cholesterol, heart disease, type 2 diabetes, all of that good stuff. Adults should have at least 30 minutes of physical activity, and children should have at least 60 minutes. You can start off with something simple. You can do yard work. You can pick up leaves. As I said before, you can take the stairs instead of the elevator. You can park in a far place and walk. You can even make it fun. You can start by skating or dancing. You could play a sport. Who doesn't like to play sports? Ice skating, pretty much anything fun. It doesn't have to be something that you don't want to do. You make it fun, and you're more likely to become active.